All right, hello, I'm Dr. Adela Timmons, and I built a digital therapeutics creation tool. Mental health burden in the US is extremely high. Despite high spending, most people don't get the treatment they need. Mental health apps could treat more people at lower cost. But despite $10.7 billion invested in digital health last year, progress is slow. Why? Building apps and running clinical trials is slow, expensive, and requires specialized knowledge. Inroads towards adoption and reimbursement are hard-won and costly. Therapies must be built for specific mental health conditions, but the market size of specific conditions does not support needed spending. You may have heard the phrase, during a gold rush, sell shovels. If digital therapeutics is the next gold rush, you can think of us as the general store that sells shovels, pans, and more. Our general store is an AI-enhanced digital therapeutics creation tool. Researchers can log into their accounts on our web-based portal and design their therapies using our point-and-click tool. They can then publish those therapies as an app with the click of a button, and their patients can access those therapies right on their own smartphone. Think of us like an app store within an app store that also builds the apps. We also integrate AI emotion sensing, so you can use emotion sensing in your therapies without having specialized AI expertise. As a hub, we support and connect the researcher, doctor, and patient spokes. Our planned entry point is clinical research. It provides a strategic beachhead market that delivers key advantages for capturing the doctor and patient markets in the next 2 to 3 years. We've tested our MVP, and our commercial version is in development for an October 24 launch. We have $3 million in non-dilutive grant funds, over 10 strategic partners building on our platform, $250,000 in lifetime sales and government contracts with 0 marketing dollars spent to date, and a pending patent specifically protecting the centralized platform design. I'm currently running my own clinical trial on the platform with 3 fast-follow clinical trials in progress. Our team has both clinical and technological expertise with deep connections to UT researcher networks. We're FDA registered as a medical device data system, which clears us for clinical data collection. We're now seeking strategic partnerships with clinics and hospitals for our October 24 launch and selling access to our platform for $10,000 to $50,000 per project. We've been working with our mentors to address the reviewer feedback summarized here. Thank you, Texas Health Catalyst Program and mentors. We are the only platform for building, sharing, finding, and monetizing digital therapeutics. We're now seeking strategic partners to build on our platform.
Thank you. That was great. I've never really heard of digital therapeutics, so that was kind of interesting. I'm curious as to, how do you, like you said you want strategic partners, but I imagine it's probably bigger than that. Like, how do you get people to really get convinced to build on this? And am I understanding that the people that are, the clinicians that are doing it, is it a prescription for their patients? Or is it just guidance, please use this?
The researchers are the clinical researchers that build on the platform, and the way that we recruit them, well, first of all, we have 10 that actually found us before we reached out to find anyone. So it's great validation of organic sales. They're pretty easy to find. They have websites and profiles and publications where they advertise their research. NIH also publishes recent grant awards in their content areas, so it's really easy to find people that were just awarded millions of dollars and plan to do digital health research. Additionally, we're hoping that through our participation in the Texas Health Catalyst program, that we can leverage strategic partnerships with clinics and medical centers like Dell Medical Center or other clinics in the Austin community. Now in terms of the other market segment, so that would be a license from the researcher that would use the platform to do the project. So there would be clinical wraparound services for remote data monitoring, which would be a subscription service. And then we would have other market segments as well. So we would go through the market segments in a strategic order, with each one delivering key strategic advantages to the next one. One of that includes D2C wellness market, and the other includes prescription digital therapeutics. So in that case, we'd be taking transaction fees of all the universes of therapies that are built and monetized on the platform. We would take a 30% transaction fee.